Hello everyone, this is Dr. Agata Moscicka. I am a consultant neonatologist at Emirates Hospital Jumeirah. I am also a certified lactation consultant and health educator. I am here today to talk with you about safe sleep for the babies and the ways to reduce the condition called SIDS. SIDS comes from sudden infant death syndrome. This is the death of the previously healthy baby who dies usually during sleep. But there are ways to reduce the risk, and I'm here to talk about them one by one. So do you think this baby is placed in a crib, in a safe position, in a safe environment, or we can do something to keep this baby safer? Let's see. Recommendations regarding safe sleep were developed in 1990s based on research and trying to save lives. So number one recommendation that came from American Academy of Pediatrics says that the baby should sleep on the back during night and during naps. Sleeping on the tummy can cause the baby to rebreathe the same air or to affect the airways, and it's unsafe. Number two, room sharing but not bed sharing. We recommend that the baby sleeps in the same room as the parents, close to the parents' bed, at least for the first 6 months of life, but not in the same bed. Overheating. When we put on the baby too many layers of clothes, hats, blankets, the baby may get too warm, and this can lead to increased risk of this unfavorable condition called SIDS. So, no overheating. Feeding the baby with human milk or preferably direct breastfeeding is known to be protective factors. So if you can, please feed your baby with human milk. It can help. How about pacifiers? So, research says that when the baby is sucking on pacifier during the night, the risk of SIDS is reduced. We recommend pacifiers only after direct breastfeeding is established. You can offer pacifier, but if the baby does not like it, we are not forcing. The mattress in the baby crib should be firm, which means it easily comes back to this initial position when we press and release the press. Keep comforters, pillows, blankets and bumpers out of baby sleeping area. How about the hats? So the babies do not need hats. Hats are not indicated, and the baby should not sleep in the hat on the head. We have our beliefs that the babies will be warmer, but that's really not necessary. There are certain circumstances for very small babies. After discussion with the healthcare provider, in some circumstances we can use the hats for sleep. Otherwise, the research says no. Talk about safe sleep practices with your healthcare provider during health checks, regular visits, and vaccinations. How about swaddling? We do know some babies love to be swaddled. They sleep better. Swaddling is not contraindicated. We can swaddle the baby as long as the baby is not rolling. This usually happens at 3 months of age. Therefore, after that time, we do not recommend swaddles. Providing skin-to-skin care with your baby is very important. It's bonding, it helps with milk production, so you can do it on unlimited occasions. However, when you do it on a couch, when you do it on an armchair, when you feel that you are tired, please put your baby directly to sleep, to his own crib. To reduce the risk of sudden infant death syndrome, keep home environment smoke-free. We also do not recommend to use any type of monitors, beeping devices, motion devices that are sometimes purchased in order to reduce the risk. Recommendation says they should not be used. And how about tummy time? Tummy time is very important from developmental point of view and brings a lot of joy for the baby. You can start within few days after you give birth, but only when the baby is awake. The tummy time frame is increasing as the baby grows and brings plenty of benefits. So we can summarize our recommendation regarding safe sleep in 3 sentences. A stands for alone, room sharing but not bed sharing. B means sleeping always on the back, during day, during night, and during naps. And C, in its own crib. So, this an unsafe sleep environment. And here I will show you how we are going to make it safe. Blankets, no need. Bumpers, no need. Pillows, no need. Toys, not in the bed. Hats are not necessary. So here we reached the safe sleep environment for your baby. The baby is in a crib on the firm mattress. The baby is alone, swaddled in the safe manner with no hat on the baby. Dear parents, at Emirates Hospital Jumeirah, we provide excellent neonatal care, both for babies who are born at term and for those who are born as a premature.